Welcome to the My Practice, My Business Roundtable. Today's topic is actually the Hygienist Roundtable. We're excited to be here with 6 hygienists that have been through our training here at My Practice, My Business. And I want to go around the room and first of all, introduce you to myself. I'm the co-host. I'm Dr. Rob Thorup, president of My Practice, My Business.
I'm Tracy Thorup.
With my sweetheart, what do you do here at MPMB?
Oh, I'm the boss in general, right? I'm the CEO of My Practice, My Business, Tracy Thorup.
It's always the CEO can fire the president. I just have to remind her about that all the time. And if we could go around the table, I want you to start out over here. And Becky, if you'll introduce yourself, where you practice, how long you've been in hygiene, where you went to school at, and do it in like 10 seconds. If you would, that would be perfect.
All right. I'm Becky. My name's Becky Earle. I live in Bountiful. I went to Weber State University and I graduated in the year 2000.
2000, fantastic. So you've been practicing hygiene for a long time.
A long
Awesome.
time.
Worked for Mill Creek Family Dental, right?
Yes.
Excellent. Ashley.
Hi, I'm Ashley. I work at Mill Creek Family Dental, and I've been in hygiene for a little over a year. And I was a dental assistant for Dr. Baird for 8 years as well.
Oh, wow. So you did the progressive graduation. That's awesome. I love it. Aubrey.
My name's Aubrey. I also went to Weber State, and I also work at Mill Creek Family Dental, and I have been a hygienist for 6 years.
Fantastic. Okay, Christy.
Yes, I'm Christy Barney, and I have been practicing hygiene for 16 years.
16 years.
Yes.
Excellent.
I've worked in dentistry for 21. So I
What did you do
started
before
as an
hygiene?
assistant. I was an assistant.
Oh, fantastic. I love how you all progress like that.
Yep. Went to Weber State, got my degree, and I work for Cannon Family Dental and then for another doctor in Ogden.
Awesome. Thank you. Okay.
I'm Holly Brown, and I also went to Weber State. Great. And I work for Oak Ridge Dental, Dr. Brian Call in Farmington, and I've practiced for 16 years as well. So
Fantastic. Tatiana.
Awesome. So I'm Tatiana. I also graduated from Weber State University. Look at us.
Wow. Wait, everybody from the table went to Weber?
I forgot
Look
to say.
at us represent.
I didn't plan this. This is amazing. Maybe it says something about the school. I don't know. Keep going. Sorry.
No, you're good. I practice in Logan, Utah for Dr. Tyson Peterson, and I've been doing hygiene for 17 years.
17 years. Wow. So we just slowly progressed around to the old man. Great. I've been practicing for a while, and then we'll leave it at that. Okay. Well, I'm excited, ladies, to have all of you here, and I can't wait for our viewers to watch this on our YouTube channel and to hear your stories, because I've heard some of the stories, and my jaws hit the ground, obviously, when we were talking earlier. And I want to start out with the million-dollar question that we see all the time. And I'm going to open it up to you. But remember, only one of you can talk at a time. No, actually, I know all of you can talk at a time, but if just one of you talk at a time, it'd be really awesome. Is periodontal disease curable? And who wants to start?
Yes.
Go for it.
Since I'm the old one.
Since you're the old one.
Now, have you always felt that periodontal disease was curable, or is it something that going out of school you recognized, or just through experience that you've just determined that? I'm curious as to the evolution of that thought leadership.
Well, I originally didn't think it's curable, and I treated it that way forever, and I knew in my mind, like as I worked longer and then I was curing it, but they still say that you can't cure periodontal disease, but I did it. I knew it's been able, I've been doing it, and so it's kind of exciting to know
And
if you can.
I want to get into those stories with you too, on what you're seeing and why you're seeing it being curable. And what's interesting, Becky, is, again, I'm going to throw this out here, and you guys have heard me say this. What would medical do with an infection? Would they just like treat it one time and then put a patient on forever infection control protocol? And somebody, it was a hygienist in one of the trainings, said, yeah, we call it supervised neglect every 90 days. But how would medical treat periodontal disease if it were treated at the ER, Instacare? Wouldn't they throw everything at it? And I want to get into that in a minute. I just want you to think about that. Is periodontal disease curable, ladies? Y'all think it is? Periodontal disease curable? That's so weird. Yes.
So I kind of feel like with periodontal disease, like I think we kind of were taught, you know, like once perio, always perio. And I think there's the difference between the effects of periodontal disease
Ah,
and the actual cause of periodontal disease.
so
So
the cause versus effect,
yeah, a lot of the times we can't reverse the
the
cause
effect,
of, yeah, the effects of perio.
Yeah, bone
But
loss.
yes, yeah,
Sure.
yeah, that
Attachment
it's
loss, but
kind
we
of
can
irreversible, but we can eliminate the bacteria and the cause of periodontal disease and see health again.
Christy, I'm glad that you brought that up because, and again, we just have a outline to follow, but I want free thinking here. I had a patient in the other day that one of my hygienists treated with Strauman's Emdogain, and he came in and he has a tooth next to it that we need to do root canal therapy on. It's just necrosed, ancient, decrepit, disintegrating rapidly, right? So, but I looked at the tooth next to it that we had treated with Emdogain. Oh my goodness. It's like bone has grown up the distal side, furcation is filled in, kind of exciting stuff. And I hadn't seen him. My hygienist, who, you know, as you all know, I trust my hygienist, co-diagnose, treat, and I didn't see the final product. I just saw the measurements, and my hygienist said, hey, he's great. I'm cutting him loose. We got bone that filled in some of the areas. And it doesn't happen with everybody, but that's where the effect kind of, you know, we're able to grow back a little bit of bone in an area, but that's the exception to the rule, right? So you're absolutely dead on, cause and effect. What's been your experience with treating periodontal disease before you trained here at My Practice, My Business, before you were taught the protocols that we've been following since 2006? So before you were trained on it, what was your experience before in treating patients? What did you experience with root planing, perio maintenance? Anybody want to share?
Lots
Yeah.
of bloody prophies.
Lots crime scene prophies is what you saw.
Lots of that.
You know, were patients readily, you know, 4 millimeter or less pockets, no bleeding on probing, healthy, move back to 6-month recare? Could you ever do that?
Oh, they tell you shouldn't
They tell you shouldn't move the patient back to 6-month recare.
because their bone is gone, so therefore periodontal disease.
Therefore, in conclusion thereof, you have periodontal disease because you have bone loss. I'm going to let all of you in on a little secret. You know how old I am. I have bone loss. You know, I mean, natural bone loss from being an old man. Does that mean that I have periodontal disease? I mean, I have no bleeding on probing. I don't have, you know, 4+ millimeter pockets, but I do have a little bit of, you know, tissue recession, and my interseptal bone is, you know, blown out a little bit in some of the areas. Do I have periodontal disease? No. Really weird.
I always say this, and you guys have heard me say that before. I always like to say that, well, I was pregnant. I might have the effects of the pregnancy with the mommy pooch, right? But that doesn't mean that I'm still pregnant. It's not going to happen. Not gonna happen. But so that's what's really frustrating to me is, yeah, you've got the bone destruction, and you know, with Emdogain, that's another discussion. But if you don't have the other two, then you can't have the infection, and that's where it's gotten really interesting to me.
So when we started the protocol, I gleaned it from working EMS and working infections in the ER. I don't know if y'all remember me telling you about this. And just one day I'm like, why are these patients, why are we letting them run around every 90 days with infection in their mouth? And then I started putting 2 and 2 together, and that's how the aggressive treatment started. And with my hygienist Annette, and we started putting 2 and 2 together, and our patients were getting healthy. And we were, you know, we were moving them back to 6-month recare. Now, I don't want to get ahead with everybody, but we have over 200 documented cases of patients with full-on periodontal disease, treating them aggressively, how we do here. And we have 7 that have fallen back is all. All the rest are on 6-month recare. So what I'd like all of you to do is, like we were chatting about earlier, Ashley, tell us the story about your patient that you treated, went to another office, and I don't want to give it away. Go for it.
So I had a patient I diagnosed with periodontal disease. He had active pockets, active infection, but he came in with a kidney transplant paper for me to fill out. Hey, I need you to sign this. And then there was boxes, you know, And one of the boxes said that he had to be free of periodontal disease or any infection in the mouth.
Isn't that funny though? Medical, you've got to
Yeah,
be free
medical.
of periodontal disease before they'll do certain surgeries.
Yeah.
So there must be some systemic link that medical sees, and yet why are we not aggressively treating periodontal disease and allowing infection to circulate in the system? What are we not doing?
You know what? This is where my brain is going right now. So they're saying the patient has to be free of periodontal disease, but if you were in any other office that once you have perio, you always have perio.
Ashley, would you have been able to? Okay.
How does he get the needed treatment then
Right,
if you
if he
always
always
have
has
the
it.
Once you have
infection?
perio, you always have
I mean,
perio.
and I feel like that just goes to prove the
It's
link.
controlled.
Yeah.
He still has it, but it's controlled. Okay, keep going, Ashley, with your
Yeah,
story.
I mean, I think just what you guys are saying, it absolutely just like shows that the link of oral and overall care, which is what we're all about as hygienists, right? And that's what we learn about in school, and so that's what we teach our patients, and that's what I taught him. And I said, okay, I can treat you for your periodontal disease, and I'm not going to sign it until you have no pocketing and no bleeding in your mouth. And they went forward with treatment. I started him. I even did the whole cleaning, everything.
How much was the treatment that you proposed?
I think it was about $2,500.
About $2,500 out of pocket.
Yeah,
Insurance would pick up the rest. Interesting. You mean it wasn't like $1,400 like we typically see around here?
Right.
Weird. Okay,
Weird.
keep going. Anyway.
Yeah. So I treated him, and we were starting to do the recare process, and he also had 2 teeth that needed to be pulled that were infected as well. They were like broken at the gum line, decayed, everything. So Dr. Baird and I talked together, hey, we let the patient and his wife know, hey, we're not going to sign this paper until this is treated. So I don't know what happened between after the cleaning and where they changed, but at some point they changed.
So you had him on multiple therapies
Yeah.
that you had him come back. How many weeks?
Every 6 weeks.
6 weeks.
After,
That's so weird.
not every 3 months.
Not every 3 months? Okay. And just so we're all on the same page, everybody watching this, medical brings back somebody with an infection on the arm, leg, wherever. They bring them back every 10 days. And they anesthetize, wire brush the wound. Instead of a regular soft bristle toothbrush, it's a wire brush. They, before they even start, they get a culture on the infected wound, right? And see what bugs are fighting, and antibiotic ointment and systemic antibiotics, and bandage it, and back in 10 days for a repeat. That's so crazy, right? Why would medical treat it like that? And the average patient takes 5 to 7 visits in a wound clinic. Okay, so you're on what number of therapy are you on?
I believe it was like after the cleaning, I think he'd come back maybe once or twice, like for
Okay.
the 6-week recare. So I was
Gotcha.
kind of
So, yeah.
in the middle of it. He was still not improving his home care all the way either, but I don't know what happened, but they,
But you got him down to where he was at least looking almost there.
yeah, like if he had allowed me to keep treating him, then I think I could have, reduced pockets, all the things, as long as he was doing his end of the deal too, right? The home care.
Of course, yeah. They have. Why do most patients have periodontal disease? Their home care sucks.
I mean, I always explain it that we're a team. I do my professional care, you do your home care. It's equally as important.
Yep.
And he knew all that. I explained everything all up front, and him and his wife decided to go to another office. I don't know why. I thought we were all on the same page.
Because you
but-
wouldn't sign him off right away.
But I wouldn't sign him off. That's
why.
the thing.
He was
Yeah.
so close though from what you had said.
I mean, a few months later, I would have been like, ding.
Back to 6-month recall.
Yeah.
Yeah.
And
So-
Dr. Baird and I discussed, we're not going to sign this until he does what he's supposed to do on the form. And, we're not risking our license or our
Right.
end of the deal on it.
Yeah.
And so he decided he wanted
Go
to go
to
somewhere
another
else. And
office.
they told him he didn't have perio, and they signed his paper.
So weird that you did all the heavy lifting, hard work,
Yeah.
and his home care is improving. He's just right there. And now he goes to another office. Oh, you don't have periodontal disease. Well, that's what happens to my patients once we move to 6-month recare. They move out of state or somewhere. They're not diagnosed with periodontal disease.
Yeah.
They're on solid 6-month recall. Another story. Lay on another one. Give me another one of patients that you've treated, and what has been the outcome. Well, first of all, let's back up. When all of you treat periodontal disease, do you just start treating it without knowing the type of bacteria that you're faced with? What do you do? Kind of test your own
Saliva samples.
saliva sample. That's so weird. Okay. And what does that saliva sample say to you when you get it back?
It tells us like what bacteria are most active in their mouth so that we know what modalities we need to use to fight it.
What are the modalities? I mean, most offices, they're not using antibiotic directly in the sulcus. They're not doing systemic antibiotics. So
Yeah, the systemic antibiotic, the local antibiotic, we do lasers in our office, but also like what mouthwashes are going to respond? Is that bacteria best going to respond to? What, are there certain toothpaste or oral probiotics? Like those types of things are all helpful as we treat in an effort to get rid of the disease.
So you're basically treating it like medical would treat it, and not like traditional dentistry. How do y'all feel about treating periodontal disease traditionally before you came through training? What was your experience treating it traditionally?
I felt like it was almost like our hands were tied because people are so used to be treating it how insurance treats it, not how they need to be treated.
Treating it to insurance limitations?
I think we need to go back though and talk about what really that is. I mean, from a front office perspective, if I understand you correctly, most of the time we'll hear an office say, well, we're going to do half of the mouth today and do maybe 2 quadrants. And because insurance won't cover all 4 on the same day, let's wait, at least X amount of time. And some insurance companies are really particular about how long to wait in between 2 before they pay for it. I haven't heard much of the protocols before training of offices using any type of medication like Arrestin due to cost and the fact that insurance doesn't cover it, right? So we have all those things that, from what I understand and what I've seen, it's do half of the mouth, wait, do the other half of the mouth, and forget placing any type of antibiotic because it's not covered by insurance. So let's just squirt water at it and give you a mouth rinse.
Give you a mouth rinse.
Is that kind of what you have experienced in the past with that or seen, or what would you say?
Yeah, I feel like we learn all of these things in school about like how to treat it, but then you get in real world and your office is like, well, your insurance doesn't cover that. And then people are like, well, I don't want to pay for it. I have insurance, because they're kind of used to how like medical pays for it, but dental's a whole nother ball game. And
Do you think it's our fault though that we've conditioned the patient to pay like that?
yes.
And so how did you break that pattern with your patients in showing them a treatment plan of treating periodontal disease in the $3,000, $4,000, $5,000 range? How did you break that? How has patient acceptance been in teaching the patients that you can treat it with this non-surgical approach and be effective over 90-95% of the time? What are you doing to break down those barriers?
I feel like education has been, which is what I have loved. I feel like with this protocol and this program of treating perio, I really have time to really, really educate my patients on periodontal disease and its effects on our oral cavity and our entire body. And I feel like it creates ownership instead of saying, well, we need to do this. And I feel like we have programmed our patients very much to like, well, if my insurance covers it, then I'm going to do it. And so I think verbiage is a huge thing, and it's that you're worth this treatment. Like your oral health and your systemic health is worth this treatment, and having them own it. And I feel like when patients get it and they're willing to invest in themselves, that is where change happens, because it's like, oh, well, I'm paying $3,000 to get rid of this disease. I'm going to actually start brushing my teeth twice a day, and I'm going to floss every day, and I'm going to rinse with the mouthwash, and because I'm investing in this.
You're going to keep your appointments, not cancel last minute.
And they're more likely to show up at their 6-week appointment because they've already been invested. They're going with it because once I feel like if they have to pay for it, then they're invested in it. And then they keep coming back because before we did my practice, my business, I would treat them for periodontal disease, and sometimes, like I would say, like at least a quarter of the time, they won't come back for their 3-month recare appointment, and so then I was like, oh, I'm gonna have to start all over again.
All that work for nothing.
Yeah. So that's funny to bring that up, Becky, because as Tracy will confirm with me, the reason why insurance companies want you just to do 2 quads of perio and then have them come back for the other 2 quads is because 17+% of the patients will not come back. So that's money in their pocket, and that's actually statistics that they have ran. The other thing too is it's like back in my EMS days, if I was treating somebody with a cut on the arm, and what's that?
Cleaned half of it?
Yeah, and I clean half of it, and I tell them, come back. I've never in all my years ever thought that if I clean the left side of the mouth that the bacteria on the right side are just going to stay put.
Right.
I mean, so we all know the research that's out there. If one spouse has perio, they can pass it to the other spouse. We have treated
Oh, I have stories.
couples. Yeah, it's pretty amazing.
You're like, oh, you have perio? Okay,
Yeah.
you probably are gonna
We've
have.
done that with saliva samples.
Yeah.
Like we've compared, and they're the same.
Yeah,
Like the bacteria from husband and wife. they're
almost
the
identical.
same.
You don't always, and you're not seeing that between 2-3 different patients. That's so funny. That's a good point. And then the protocols that we're talking about here at this roundtable, we've taught a protocol where we treat them every 6 weeks. And these wonderful hygienists are going in using specialized instruments and medications and technology and know-how and attacking this disease process every 6 weeks with a certain protocol that can last up to 6 appointments, and they're eradicating the periodontal disease. And a lot of periodontists, I mean, you all know that I've taken arrows in my back from periodontists here locally, and it's like, I love the one kid who, and I call him a kid because I looked him up, he was young, he wrote an article in the ADA news and said, can we stop reclassifying periodontal disease for the umpteenth time and just come up with a protocol to eliminate the disease because it's curable. And I love that article, and it was bold, and then nobody responded to him. That was what was really weird. Nobody's responded to him at all. And I love the fact that, and it's no mystery, I mean, we'll just share it, our protocols run about $5,000 when everything's said and done. Insurance covers about $600 to $800 of it on the average. So the patient's paying out of pocket a significant amount of money, and everybody's like, oh my gosh, we're charging the patient too much, we're nickel and diming the patient. And I'm thinking, this is a non-surgical approach that is increasing the health and well-being of our patients and helping them systemically. And everybody freaks out over that $3,000 or $4,000 payment. Yet I just had a patient just last week that we did 6 anterior crowns on for over $6,000.
That was my argument. Is I think from a front office perspective, we look at that and go, but, and I think it's mainly because the front office is not as educated as you all are with the perio protocols and what it entails. And I look at it and say, well, heck, we don't even hesitate when we give a patient a bill for crowns,
two root
multiple
canals,
crowns,
2 crowns,
or
and
bridges,
it's the
or
same
so
out
on.
of pocket, yeah.
And we're going to spend what, 3 hours on that patient, but we figured it out to be roughly 8.5 hours that you
For
guys
all
are
of
spending
you to
on
eradicate the disease, yeah.
this
That
patient.
doesn't save their life.
And
Yeah,
it doesn't save
okay.
their life,
Now-
which somebody had a story about their pancreatic patient. Who is that
Oh,
that
it
was
was
telling
me.
me? So tell me about that one.
Oh, well, I had a patient, he came in, I'd been cleaning his teeth for years, and he came in, and that day he just had, like, all of a sudden, he had bleeding gums, his pockets had increased, and I was like, something is wrong. Something is really wrong. And I treated him for periodontal disease right that day. Like, we did non-surgical periodontal therapy, started it right that day, and I think it was 2 days later, his pancreas ruptured.
Wow.
And if I could have had a crystal ball, I mean, I knew something was wrong, and now he's invested. He always comes and he always mentions that, and he thinks I'm like his savior because I knew something was wrong, and even though I didn't.
And the two could be a serendipitous event, but infection in the mouth is attacking the organs.
Yeah.
And I hate to say I love this story, because I don't love this story, but you've all heard me say it. That young man in Heber dies of periodontal disease, attacks the lung. The NFL player last year dies of periodontal disease. We had 2 people in Utah County die of periodontal disease at not full-on nursing care, extended living care. They were healthy, and most of the teeth in their mouth. And when the biopsies are done, it is what it is. And that's why I say to all of you, do never undervalue what you do. You are prolonging and saving lives. Am I wrong? Is that really what's going on here?
Well, and I think the new protocol is so awesome because it's really exciting, the things that we're seeing. And I think it used to be kind of almost a death sentence when you diagnose them with periodontal disease.
It used to be
'Cause
what?
it's a death sentence.
A death sentence.
Like,
For the
yes,
patient or for
yes.
you?
Well,
For the office?
Forever.
yes. But I mean,
A death sentence because they were on forever perio?
you're sorry, you got perio. We'll be
That's
seeing
so
you
funny.
for the rest of your life, you know?
Yeah. A
And
death sentence. I'm going to use that one now. Thanks, Holly.
but now we can say, you know what? We can get rid of this and we can overcome this disease and get rid of this bacteria. And I think for a lot of people, that's awesome to say, yes, you have this, but we'll get rid of it. It's
Isn't it-
not the end of the world.
Isn't it fun to see your patients get healthy?
It's empowering.
It is.
For me. Like it
Empowering.
is so empowering
Wow.
to feel like
You're
I'm
changing-
saving you.
yeah, you're changing
like
their
I
life.
literally am like changing your life forever. And I feel like before, like you would do scaling and root planing and I would get in there and clean and I'd irrigate and I feel like there was improvement. Like I would get patients back and sometimes I was able to see healthy patients come back.
Especially
And-
if
but I never moved them to a 6-month recall because once perio, always perio. Like once a 4910, always a 4910. But if they came into my office and I saw them, I would say, "Oh, you're a healthy 1110 patient." Like, you know, so I always struggled with that. And sometimes I felt like, okay, we're gonna do the scaling and root planing, and you need to do this with your hygiene, and I want you to rinse with this mouthwash. And sometimes I kind of felt like I was giving false hope. You know, like they'd come back and it's like, okay, we're gonna probe again. And then it's like, oh, I still have 5s, you know, and in my head I'm thinking, please be better, please be better. Like I feel like I'm digging a hole that's just caving in on top of me. And it was hard.
and you care about your patients, obviously, Christy.
Oh,
it
a
shows in your
ton.
statement.
Yeah, a ton.
And so,
So it's exciting to see improvement.
yeah. So what are you seeing with your patients now with pockets and
So
bleeding and
I
everything?
had one
What's your
come in
overall-
that had some pocketing and bleeding and bone loss, and this patient was really hesitant to do the treatment, and he accepted, and we started, and he's got one more treatment. He's coming in fairly soon to finish his last treatment, and I feel like we've nailed it. Like the last time I saw him, he had one like 5mm pocket that didn't even have bleeding.
Yeah.
But we cleaned it and treated it again, and I'm hopeful. Like it just feels like I don't feel like I'm digging a sinking hole. Like I feel like I have good news to give him. Like, oh, look at this. Look how exciting this is. Look at where we started and look where you are. And
You're winning the battle.
yeah,
Right?
yeah.
And
That's-
fast.
Does that feel like an uphill climb?
Yeah.
Like,
Yeah.
I
Yeah.
think I really like the 6-week recall because I feel like you can like really get on top of it on our end too as a hygienist. Like, oh, you should try this tool or try this toothpaste or try this, like, and we can like attack it rather than just waiting 3 months and then having their toothbrush go on vacation with them, like you guys said. Like, you know, like I think they just fall out of those habits even over 3 months of time. But when you're on them every 6 weeks, you're on it. Like, and you can attack it on your end and then educate them and tell them how to do it. And then if they do it, then they see the results too. And I think I've had a lot of patients, like, I ask them, like, have you noticed a difference? Because I want them to feel good too.
Ooh,
And they're
what's
like,
been their comment there? Because I
Oh.
want to add on that.
yeah, I mean, I feel like everyone that we've treated has noticed a difference. Like, I treated a girl that was right in the middle of her pregnancy and she just knew there was something going wrong. And I treated her and like everything, she's like a perfect patient. Like, and
Yeah.
she was so happy and could tell a difference in her body and her mouth. And she could tell like she had inflammation in her body. And when I treated her, it went away.
Well, I feel like too, like they notice like the like oral differences. So like no bad breath, like their teeth feel cleaner or whatever. But like I've had people come and like, I have more energy. Like you just cleaned out all this infection and I feel great. And I'm like, yes.
And then they're more motivated to maintain that oral health, right?
Yeah. Well, they share in the excitement with us.
That
I always tell them I cry a happy hygiene.
Yeah.
tear.
But you do. Like it
Really,
is
though.
so.
Like, it really
Yeah.
truly warms
I'll
my
tell people
heart.
happy
Like,
dance.
Yeah.
Like
And I know I'm
happy
like
dancing.
somewhat of a newbie in the hygiene world, but I'm like really passionate about it. And when I see that health and I know that I contributed to that, it like my heart really is warm. Like I love it. I love that feeling. And that's why I got into hygiene. I love it.
It's amazing. You're not just cleaning barnacles off people's teeth, but you're actually improving their overall health.
Yeah.
So everything seems to start right here. A lot of things do, not everything, but a lot of things start in the mouth, and that's where it becomes a problem. What do you think has been, if you were to hone in on just one modality that we taught you on the hygiene protocol, I want each of you to give me just one bullet point of what you think has been like a game changer in treating periodontal disease from how you did it traditionally. And I can kind of think what what some of you might say, but Tatiana, give it to me. Let me hear it.
I think probably the biggest thing that's helped is, I guess kind of overall the treatment and how you do it, because
But
it
give
was
me
hot.
one. Give me just
I know.
one
The
tool, one tactic.
The fact that they're coming back every 6 weeks,
Yeah.
and we're getting paid for it.
And getting paid for it.
In
What a
the
concept.
sense that
Yeah.
like we're able to put it into our schedule and continue to be productive, because before it was like, well, they can't come in for 3 months, so it wouldn't be productive to have them come in any sooner. But so this allows the dentist to also understand like this is good and we're helping patients, but we're also keeping the lights on, And I think that is, at least for us, it's allowed us the freedom to treat the patients the way they should be treated. And
because of how you bill for it.
yeah,
and how you
keep
get
the
paid
lights
for it.
on and
I want to come
get a
back to that
paycheck.
pay. I do, definitely. Holly, tell me just like one of the little concepts, modalities that I taught you. What's been like that you've seen for your patients? What's another game changer? That's a game changer.
We really love the minocycline gel.
Minocycline gel.
I mean, we just cover everything.
You can-
Just give them a minocycline bath. I mean, and even for patients that just have some inflammation, I think it helps a lot with just the prevention of periodontal disease. We see a lot of, gingivitis codes, and we see these patients that we can help prevent it from progressing even more. But the minocycline is like,
it's a game changer too.
it
isn't
really
it?
is.
And
It really is.
looking at it from a billing perspective, and for those of you watching, we used to, when we did, Arrestin was the name of the game, and
Per
when you
tooth. And it's
when you look at that at 40
to 40
bucks
bucks a compule,
per tooth, and insurance does not cover it,
or they cover it at $30 a tooth.
or they just
You
tell
might break
you,
even, not just on the product, just on the direct operating
you're
cost for
you're
the
not in a
cost of goods.
position to be able to absorb that cost in your office, especially with the lack of knowledge with these billing techniques. So now we have the minocycline gel that you can nuke. I call it nuking. We just can nuke that whole
Like I
area.
said,
You can be liberal with it because it's cost effective for you. And yeah, you're still getting billed. You're still charging the patient for those services. It still costs you money to deliver and to have the medication. But I love the fact that you guys can be just liberal with it and not have to worry about that one tooth times number of times that you have to apply it. So I love that stuff.
So imagine following the protocols that I taught all of you. Back in the day, we would use Arrestin and we would hit every zone, and they would literally walk away after 5-6 therapies, they were walking away with $1,800 just in antibiotic
In
therapy. So if you were doing the same thing, yeah.
And the time.
And the time.
Like I saw a patient probably 15 years ago that he had a full mouth perio, and there was a prescription plan of some sort at the time that medical would cover Arrestin. And you had to do so many X amount of sites or more.
Yeah.
And so we placed probably 50 sites of Arrestin on him, and the medical covered a portion.
Yeah.
But it took forever to plug in.
Because it's just
all
blowing
those
powder in there,
sites,
right?
yes.
Yeah. Oh, totally.
It was wild. And then he was in our office last week and had all of his teeth extracted. So
Yeah. Also that product didn't quite work like it was supposed to. Sorry.
that one time
We shouldn't be laughing.
application.
Was he
Yeah.
brushing his teeth?
I don't know.
Debatable.
And imagine,
Vacation.
imagine having these protocols back when he first started.
Right.
He wouldn't be getting dentures.
Right.
Chrissy, what's the one game changer that we taught you?
I think for me, it would be starting at the top, and I would have to say the oral DNA saliva test. Because I feel like it's a visual for a patient. So it's not just me saying, you have periodontal disease, and I could just be, blowing hot air. I can say, okay, look at your results. Like, these are the bacteria that are there. You're above threshold here. This is what it recommends. Take it home, read it, look at it. So it's not just me. It's coming from a lab that's analyzing it. And so I feel like it just kind of...
It confirms
It
your
allows for
findings.
education, is what I feel like. It allows for
Education's killer.
education. It allows for me to help them understand the necessity of the treatment.
And I
that
told you
we
the story
propose.
that Nichelle had with the nurse, and the nurse is like, no, I'm not, it doesn't hurt, I don't believe you. And Nichelle said, at least let us run the saliva test on you, get the test results back, I'll send that to you. And she said, we'll pay for it. What that she was really saying is, Rob will pay for that. And I didn't even ask him, right? But I love it that I have that kind of relationship with my hygienist. I will back them up on this stuff any day. We'll take the test, we'll send it off the lab, then when it comes back, make an educated, and bringing up education, make an educated decision. She's a nurse, it's like, nurses are the worst sometimes.
They want to see it.
Yeah,
I want to see it though. Like, that's me. Like, I want to.
We're analytical.
Yeah, I want to know why. Like,
She got that, and within minutes from that email going out, oh my gosh, get me scheduled. And she, again, we moved her back to 6 months. She's been back to 6-month recare for 4 years now, going plus. Yeah, she, again, it was like educating her.
Yeah, it clicked.
Yeah.
Well, and that's the thing too. It's I think lack of knowledge of cost of goods and overhead. I think that we've conditioned the patients. We've been the ones to get the patients to think, to be dependent on their insurance and what insurance will and will not cover. We've undervalued our services. There are so many different factors, and so once you
Undervalued what you ladies can perform. It's unbelievable what we've done to you.
And because of it, it kind of feels sometimes like we're going up we're fighting an uphill battle because everybody around us is unfamiliar with how really they should be treating it. So then you get a patient who assumes that we're just trying to take their money, and they're not seeing the understanding of it. And so when I see that third party that confirms the diagnosis, I think it's extremely powerful.
Another interesting one that we've had some of our clients do, and we're all about choice, you all know that, and they're like, look, I can treat it traditionally like the office down the street will do, 4 quads of SRP and put you on forever supervised neglect, or we have this protocol that's 95% effective, a non-surgical approach. This costs more. This is going to maintain the infection. Your choice. And they have literally been giving the patients the choice like that, and the patients are taking the better treatment. And amazing, right?
Just barely. Yep.
Had one of those.
Yep. Come in, been to a periodontist for 21 years.
Patient's been going to periodontist for 21 years.
Yep. We'll just come in
Tell
for
the story.
X-rays and an exam
Yeah.
for our office. And I had her in, and I just thought, oh, do I tell her? Do I not? Do I, like, I don't want her to feel like I'm like taking her away from people she trusts.
Taking her away from the
And
dark
I don't
hole.
want her to feel like, you know, and I didn't want her
I'm
to
sure
feel
I'm gonna
like,
get a few write-ups
she wasn't
from
being
periodontists
treated
off
right.
that statement.
Right.
Yeah,
So
yeah.
I just told her, I said, you know, I just feel like I need to give you the option. We have a new perio protocol that we're following. And, you know, this is kind of what we do. I said, not that your periodontist is doing anything wrong. Like, they're cleaning you, I'm sure, very well.
Maintaining that infection perfectly.
But I asked her, I just said, you know, have they done like a saliva test? Are they administering local antibiotics or a
And
systemic
what were the answers to
antibiotic?
those questions?
And she's like, no, they've never done that. And I just told her, I says, there is an expense involved, but if you'd like, we can do an evaluation. I can give you a treatment plan, and you can just make the best decision for you. And I did tell her, you know, that oral bacteria is linked to systemic diseases like cancers and Alzheimer's, and went through the list, you know. And she says, well, I've already had cancer. I don't need it again. And she's like,
Wow.
let's do this. Like, I absolutely. And, you know, so we're going to start it. And it's exciting. It's really exciting to me to feel like,
Oh, I can't. You got to follow up with me on that.
I can't wait to see what this does for her.
When does she start?
In like 2 weeks.
I would be so interested,
exciting.
Christy, if you'll just keep us informed on that patient, because that's the story right there. That's the story. Right, Aubrey.
I also would agree that
No, you have to come up with a new one.
Oh,
no,
okay.
I'm just kidding.
well, I'm like, it really
Because
is.
I know these are the game. If you have the same game changer, go for it.
That was one thing that we had not implemented prior to our training with the saliva analysis, and it's so cool to be able to be like, look,
And
this is
see.
what's in your mouth, and then like the
Is
very
that
last
in my mouth?
yes, well, and the very last page is like, here is this bacteria and this is what it affects, you know, and it like talks about like joints and all of this information. So it's like, it's not just me saying this, it's also
It's the
Lab result.
yeah,
It's the fact.
yeah.
Yeah.
Scientific fact. I absolutely love it. Ashley.
I'm kind of picking off yours a little bit with the 6-week recare, but I feel like it's also, along with that 6-week recare, we're not allowing the insurance to determine the treatment, which is what
Which
we've
they
learned
have
from you
for-
guys a lot.
yeah.
And so like seeing them every 6 weeks, we know that the insurance isn't going to cover that, but we also know that they need it. So especially in Utah, just being like so insurance based, we're not going to let them determine that. We need to do what we need to do, whether the insurance covers it or not.
And you know what's crazy, Ashley, is most dentists don't realize that the ADA has made a statement that we determine how to best fulfill the code. Not the insurance, not even the CDT code book. The dentist determines. And give me, Becky, one more here. And then I got
Mine'll
it.
be fast.
Then I got, wait, hold that thought. And then I'm going to get to the money topic here in a minute. Okay, yeah.
Just when you were presenting it, like that very day, like when you can see them every 6 weeks, I'm like, you can do that? I was on board like right then, because I knew that it was going to be like a game changer for me.
Yeah.
And I love it. It's like so much better. I just feel I could have a lot of power.
It's powerful.
Becky, you know what's funny is you say, wait, we can do that? That's what I'm talking about. You all are so medically, histologically, microbiologically, skill set trained on your wheelhouse. I'm going to encourage you and everybody out there, please think outside the box. Have that aha moment of, are what we doing, is it working? If it's not working, is there a better way? You know, it's the start, stop, continue, right? And analysis. Now, I'm going to ask you a fun question. I know that all of you here are not on hourly, and you all know that I pay my team a base plus commission, and they are paid significantly more than their peers, and they work half
I don't
as
know.
hard.
Hygiene school was really hard.
I'm talking about real world. Okay. So, and then it's like, and we discussed this a little bit. We were all eating dinner and having a topic, and it's funny how we were all laughing and talking about this, and now everybody's sitting around here, oh, so serious. Okay, and I love this. This roundtable is so much fun. Could I get you to go back to an hourly pay?
Never, ever, ever.
Could I get you to go back? Ash?
Not at all.
No.
Chrissy, wait. Oh, there's got to be one of you. Teddy, don't let
I
me
was
down.
nervous.
Hourly.
I actually still am hourly.
Oh, that's so sad for you.
I know.
Okay.
She's gonna go have a talk
I
with
know
her
we're
doctor.
You need to go to
We're
Tyson and have
working
that
on it.
conversation. Oh, you're working on it.
Yes.
I love it. I love it. Well, it's so hard for the doctor to do it. It really is. It scares them, but it scares the hygienist to move to that.
Yeah.
But here, you all know my philosophy. I'm a producer. You're a producer. Expanded duty dental assistants are somewhat of a producer too, right? The rest of the team supports what we do, and we can't do what we do without them. That's why the whole team are my colleagues, not just you sitting around the table, but the 2-week-old dental assistant's my colleague, and that's how I view them, okay? And it's like, if I'm paying you like a producer, like if I hired a dentist to come be an associate in my practice, I'm going to typically pay them 30% of collections. That seems to be the working average. My hygienists average 25% of their production. So they're 5% off of the dentist because your schooling's about half the amount. So I figure 5% less would be about right? That's a mathematical formula. But paying you like an associate, I mean, doesn't that motivate you more to from desensitizers to fluoride? For example, who was it that said, I've worked in an office, do you want fluoride? No, okay, fine. And not telling the benefits. Who was that? Was it one of
They
you
won't
around?
admit it.
We did have one hygienist. It's not me,
Oh,
but
it
we
was a
did have
different hygienist.
we did have one hygienist, and she'd be like, "So, you want fluoride today?" And I was like, "That's getting you nowhere."
Okay, Eeyore. Gee, don't get too excited about offering what fluoride can do for the patient. Keep me out of there. Job security, it cuts my job security. I don't want them to have fluoride, but
Yeah, we don't even ask them. We just tell them you need fluoride because X, Y, Z.
Because
and also
X-
it's this amount.
exactly.
And it's always cheaper than getting like restorative work done.
Yeah.
cheaper. Yeah.
Her insurance too.
Okay, and I don't know if you all caught on to this, but I want to share this, and my friends at home, and you all know Laura, and she had a patient who was uber sensitive, and this was like 9 months ago now, uber sensitive to cleanings. Oh, it kills me. Well, hey, you know what? We have this product called Servitec, and how about I paint it on, and if it improved your cleaning, then I'll charge you for it if it makes you happy. And if it doesn't make you happy, I'm not going to charge you for it. That was her take. That now we have so many patients that are being offered by all of our hygienists because Laura just thought outside of the box. And that's a $30 boom. On how many patients per week, per month, per year? One little 2-degree course correction, thinking outside the box. What are the other things that we could be thinking outside the box on? I don't know. I've shared with you in our training all of my out of the box thinking and using different medicated mouth rinses, which we are still doing some tests on and finding great results from most of them. But there's all kinds of stuff that we're doing. And
So
oh yeah,
I have a question, and because I know that again there are people watching at home that are listening to what we're talking about, and they're thinking to themselves, number
what are
one,
they talking about?
well, number one, that's a lot of money, and number two, they still have that. Once you have perio, you always have perio, and so have you had situations where you've told another hygienist, I'm eliminating the infection. They don't have perio anymore, and they look at you and go,
You ever had that? Other hygienists look at you
What do you
weird?
say to those people who
What would you say to people that are watching right now?
say, I just
Well,
don't believe it?
What would you tell them? Just elevator pitch before training, after training. What would you tell them? Teddy, what would you
the
tell them?
protocols in general.
You know, I think a lot of those people have never like actually experienced it,
They
right?
don't know what they don't
So
know.
yeah, they don't know what they don't know. And so for that, I would probably ask them like, okay, well, you tell me, like, what are your perio maintenance patients looking like? Do you enjoy doing bloody profies?
scenes?
Yeah, crime scenes, like, and just maintaining that. I know, like, as I'm getting older and
wiser.
Yes, and
Yeah.
wiser. And the hygienist that I work with who kind of mentored me years ago, she was just like, listen, I'm getting old And I don't want to do bloody prophies anymore. I can't do it. Like it's too much. And I think because she was so, and I feel I'm so invested in my patients, like I literally care about them. And so then, you know, for the elevator pitch, to turn around and say, so if you are okay with that, then great. But if you are tired of doing the bloody prophies, why don't you look at doing something a little bit different?
Go through
Thinking
training.
outside, yeah,
Almost
thinking
like
outside of the box, because
Yeah.
it's like if you keep doing what you've always done, you'll keep getting what you've always
There you
done.
go.
You know,
And that's what's happened for umpteen years.
And I always
Yeah.
like to think that if there was another way, wouldn't you want to know about it? And are you open to really thinking about it and exploring those other options?
well, and I think that's honestly what's nice about your program is because the research is there, right? Like anyone could go out and find it.
Yeah.
But you guys have put it into a protocol and a program where it's like, this is what works. If you just follow the steps, you'll see the results.
And I
you-
think for
yeah.
our office, a big part of it is it's gotten we have 7 hygienists in our office, and everyone has different thoughts and opinions about how perio should be, right? Like originally it was, then you see him back for a 6-week tissue check, and then you see him back, and it's like, what are we really supposed to be doing? And this way, it literally spells it out for you.
Ooh,
Like,
put everybody on the same
Yeah.
we are all so
Ooh.
yes,
So
we're
patients
dialed
are getting
in.
the same treatment.
Exactly, and that's a big part for us
Love
in
it.
our office. Is we want, if no matter who the patient is seeing, we want them to receive the same care, the same standard
Oh,
of care.
gosh,
For
Holly-
us, that's a
Holly.
huge part.
Because sometimes our patient, we try to assign that patient
Right.
stays
But it
with the
doesn't
same
always
hygienist.
happen.
Yes, exactly. And it doesn't matter.
Right.
All 4 of my hygienists are following the same protocol. And so it doesn't, I'm so glad you brought that up because I totally didn't even remember to bring that up. Good
It's
point.
huge for us.
What's that?
It's huge for us that I know that, like, if I'm on vacation, my patient's still gonna be treated really good.
And it doesn't matter. That is so cool. Okay, give me another one.
I was gonna say it's something we talk about at our monthly meetings. We always like all 3 of us make sure we're on the same page of like how we're diagnosing and like changing up how many rinses to give out per period package or whatever. Like we kind
Nice.
of like make it our own, but we're always on the same page. I feel like.
We just tell our doctor to stay out of it.
And what?
We just tell our doctor to stay out of it.
Wait, I just need to
know
hear
what we're
that
doing.
one more time.
The doctor needs to stay out of it.
Oh my gosh.
Aubrey, that's the best ever.
Well, you guys are great. Christy, do you have anything you want to add to
good. I
that?
think
or you're
they
just
summed it
gonna-
up.
You're just going to give thumbs up. Hey, I want to thank all of you so much for being here today. This has been enlightening to me to hear all of you. It's fun to get out of our caves and to come talk about these things. And I can't tell you how many people out there in our profession are going to benefit from hearing your verbiage, hearing your words, and saying, what is it that they know that I don't know? And how can I obtain that to provide better care for our patients? And that's what you've just done. I really appreciate that. Thank you so much for joining us here at the My Practice, My Business Roundtable. And this has been fun to have the Hygienist Roundtable. We hope you continue to watch our channel, and we hope this has been helpful to all of you. From both Tracy and I, good night.